By the time I got the phone call from Dr. Downey, I already knew. I had cried every day. I would drop my kids off at school and I would cry all the way to work. And then I would pull myself together and then I would cry all the way home, all the way back to get them.
I caught my cancer early through a routine mammogram, and I was able to take control of my cancer, essentially, and instead of having it take control of me.
I found my lump in August of 2007 and waited a couple weeks before I went to the doctor thinking it's nothing, it's just, it'll go away. When it didn't, I went to the doctor, and when they called the next day to tell me that I had breast cancer, I was dumbfounded.
I mean, I have 2 little kids, so I just figured I had cancer, let's figure out a way to get rid of it, and I moved on because I didn't want them to be affected.
Getting your cancer detected early definitely increases your chances of survival.
Early detection is key. The sooner the cancer is caught, the better the treatment options.
It's scientific fact that the earlier you catch it, the greater your likelihood of survival.
You know, another friend of mine who was diagnosed up here, if I hadn't described to her exactly what I saw or what Dr. Skaggs saw, she was like, it was because of what you said. That's how I knew. That's how I knew to go to my doctor and say, something's not right here. And thank goodness she did.
I have lots of girlfriends that are in their 40s that haven't had mammograms or haven't been in for a long time, so I am the one that's emailing them constantly and saying, you need to go in, you need to get this done, it's very important.
Early detection is the most important thing. Know yourself, know your body, go to your appointments, get your mammograms, do all that. And if you're ever faced with that, stay positive.
Having Shaw here and having the diagnostic center here probably saved my sanity, certainly a lot of mileage driving back and forth to Denver.
There's nothing more precious than your health, and you don't really realize that until you've actually been sick. It was a blessing that I had the Shaw Regional Cancer Center so close.
We have the most sophisticated equipment you can have in breast imaging. We have it all.
I could leave work and be up here, have my treatment, and be back to work in an hour.
You know, we have the setting and we have the technology to find early breast cancer.
And I tell everybody that I am doing better than I was before I had cancer.
Don't let it get you down, because I'm not going anywhere. My kids need me, my family needs me, and I plan to be here for years.
It's not just breast cancer, it's coming in for that mammogram. Like I said, a lot of people are just nervous about coming in. So the women that work there, we're all truly caring, compassionate listeners, and we work together. We're small enough that we work together and we communicate and we work well, and we do everything we can for the best outcome for our patients.
Talk to your girlfriends, talk to your doctor. If you think something's weird or you have a question, talk to someone, call me.